brother, see this, look at the density, man, come on, who are young, who have low grade of baldness.
If they told me about the medicine, you need to follow this medicine.
How long?
Maybe for, I don't know, maybe for 6 months to 1 year, I guess.
So, please don't go mad about all these things. Use your mind, use your brain. Hi Venkatesh, how are you?
I good doctor.
So today we have Venkatesh with us, and Venkatesh, we did your surgery around 14 days back,
Yeah,
and it was an MHT technique, a combined technique where we use FUT and FUE. So as we can see your pictures over here, so we can see now you look like a changed man.
Yeah, completely changed man.
Completely changed man. So we did a combo for you, and we did 3500 grafts, 2900 by FUT and 600 by FUE, we can see over here. So I would like to know what kind of apprehensions you had before going for the surgery, and what kind of research you were doing about hair transplantation.
So I have this hair fall problem from almost 6 years, I would say. Like I was researching about this hair transplantation clinic, and I sent my pics to the couple of clinics also. Like I'm from southern part of India, so I sent my pics to some of the clinics, and I physically went to some of the clinics. But when I went, most of the doctors, they said you need around 4,500 grafts only by FUE. Like no one told me about this FUT technique before. So I was thinking, and I was browsing the internet, and I watched a couple of YouTube videos. Then randomly I got a suggestion of your clinic, the Satya Hair Transplant Clinic. So when I saw the results, I thought I would give you a try in the clinic, and I consulted on you on December online. I made a video call, but compared to the other doctors, you were so genuine. Like you told me, like you gave me the option. Like you gave first you told me, if you want to grow the hair little bit, do this much amount of grafts, or if you want to keep your length very short, do this much amount of grafts. You were not you not told me anything as a financially. Like you just told me as a friend. You gave me the options for me only. So I thought this is the best clinic. So maybe I have to travel from southern part to northern part, but it's okay. Like just a 1 day procedure. So I thought it's okay. Then I came here and I done the surgery.
So you told that you were given options somewhere else when you consulted and showed only FUE.
Only FUE.
And around close to 4,500 grams.
4,500 grams. Yeah.
So one thing which I would like to know here is what were they doing it from the scalp itself, or a combination of body and scalp? What was the plan?
Yeah, a couple of clinics they told me you need a hair from the chest, beard, and the scalp. And one clinic they told me only from the scalp.
Only from the scalp.
Only
4,500.
Yeah, only from the scalp. So some clinics they told me, like 2-3 clinics they told me only they will take a 4,500 from the scalp, from the back of the scalp.
Okay, so now if we take a look at your donor over here, the strip which gave us 2,900 grafts, you can see over here. And if we look at this area, the FUE area, for which, I mean, from where we took out 600 grafts. So if you see this is a big area, I mean, and this is a very thin fine line over here. So what do you think if we had done, say, all FUE? For 600 we used this much of area. What would have happened if we took out entire 3,500, or for that matter 4,500 by FUE alone from this area? What would have happened?
Yeah, on the day of the surgery, when I saw the pictures, when I saw the donor area, I was like, if for only 600 grafts, if that much thin it looks. Like if you took 3500 only from the scalp by a FUE method, it looks very worse. Like it
Exactly.
looks very thin.
So not possible.
Yeah, it's
Another
not possible.
thing, we did your crown also. If we see this, we did the crown area, and if you see over here, this is the kind of safety margin which we have. So if we are doing only FUE, then we have to go up to extract. We can see good hair, thick hair in this region. They are present right now. As we know, hair loss can be progressive.
Yeah, bro.
You can have thinning. This thinning may extend down over here, and any hair taken out from this area will be gone from the front as well, because this is unsafe donor zone.
Yeah.
So if I'm doing only FUE, there is no way I can extract a good number without going to the unsafe donor zone. There are only two ways of extracting 3500, forget about 4500. There are only two ways of extracting for 3500, not even 3500, maybe 3000. One, I have to go up. Second, I have to do over extraction, not taking one out of three, maybe taking one out of two, or maybe even more.
Yeah.
Which obviously leads to a lot of scarring over here, and then it's a big problem.
It looks worse. Like in the frontal, it looks thick, and the back of the scalp, it looks very ugly.
Yeah. Did anyone discuss you with, like, you have shown so many clinics and all? Did anyone discuss post-transplant strategy? How are they going to maintain these hair? Did anyone tell you that you need this kind of medication, or you will be following this plan? Maybe, especially I'm talking about the medicine called finasteride hair. So, did any clinic or doctor discuss this with you?
No.
At that time?
No.
Nothing?
No, none of the clinics were discussed about the finasteride and stuff.
No medicine they did not discuss?
No. Yeah, they not told me about the medicine.
Mm-hmm. Did they tell you that you'll be needing some medicines to sustain the hair growth, and uh, I mean, transplant alone is not.
Yeah, they told me about the medicine. You need to follow this medicine.
How long?
Maybe for I don't know, maybe for 6 months to 1 year, I guess.
But what will happen after that? Did they tell you?
No, they not told me.
So that is the problem. See, understand, please listen carefully, because I'm telling all this because I think a patient has full right to know all these things beforehand, and before deciding for transplant, because it is such an important decision of your life. You should know everything beforehand.
Sure.
So the thing is, because I'm doing a lot of repair hair transplants, so many people come to me for repair, and I get to know all kind of stories from every part of world, not only India. I'm talking about the entire world now.
Yeah.
So many a times patients are being told that you need medications for maybe 6 months or maybe a year, but they don't tell that as soon as you stop the medicines, there will be severe rebound hair loss.
Okay.
So after 6 months, they'll say, okay, continue for another 5-6 months. After that continuation, they'll say, okay, after 1 year, use the medicines for another 6 months or 1 year. Or they might say you, okay, as long as you want hair, please use it. We don't recommend you to stop it. But that's not correct, because patients should be knowing this. A lot of people take medicines as strong as DHT blockers, which include finasteride. That's a strong medicine. And okay, let me show you certain things. Now, this was your baldness, and we can see the crown area also. We can see you had good donor, and these thinning zones, if you see here, we have done transplantation in these areas, but these areas can improve significantly on finasteride also. We can see miniaturize over here in this portion here. So these areas can improve a lot on finasteride. So what's happening? People promise numbers like 4,500, 5,000, which is obviously not possible. And then what happens? You are put on finasteride. Now these hair improve on finasteride. You think this is a great transplant.
Yeah.
People think that this is a great transplant, but the trick is, it is no doubt a good transplant, but it is not as good as you are thinking, or as good as it's being shown. So the hidden part of these stories. So that is why I always try to bring the real story behind transplants. Perhaps that is the thing which attracted you towards me.
Yeah, yeah,
So sometimes there is information on internet which makes you which tempts you to undergo a procedure immediately. Oh my goodness, what a result and all that stuff. People are mad about density. See, if I give you finasteride at 1 mg per day right now, whatever transplant I have done, it will look much thicker than that, very very dense, and you can't even imagine.
okay,
And you will be very happy. You'll say, doctor, you have done a wonderful job. Now what happens, I don't need finasteride support to do my job, because I know I have done a good job, and these hair will grow. Now the thing is, whether I'm looking for instant immediate effect, short term results, or I'm planning for a long term solution. Because if I opt for short term things, then it is kind of clinic centric, where everything, whatever I'm doing, I'm keeping my interests above your interests.
yeah, yeah.
Okay, so that means, okay, let's do as many as possible. Let's take out. I could have done beard also. I could have done more FUE from the scalp, but the reason I did not do was like, I don't want to spend more donor as of now.
Yeah, yeah.
Okay, it is not just about money. A lot of people are getting cheap transplants done, and they think they are getting 3,000, 4,000. They are paying it with their donor, and that's a very big cost, because later on you can earn money, but you cannot earn donor back. Okay, now donor preservation of donor is such an important issue which people don't.
And that is the thing that drags me here. Like one of my friend, he has done surgery in Mumbai. Like I'm not saying it's not a bad transplant, but it's okay. But he done it for a very cheap price. But the thing is, all the donor area back of the scalp is
Wow.
completely exhausted.
See, another thing, when you compare results, see, his result looks awesome. If we see this, I'm so happy and glad to see, it looks so natural and so beautiful. We have done the crown portion, we have done up till hair. This portion already has some hair, so which I've done your PRP. We are giving you minoxidil. We expect this portion to improve, or maybe later on we can put some grafts in this area.
Yeah, yeah.
So now, if I take a look at your donor looks pretty good. People are really worried about the scar, the visibility of scar. Now, just now we have removed the stitches. We can see the reduction in density in the FUE area over here, above and below, from where we extracted. And this is the stitch line which you see now, which you actually don't see now.
No, but nothing. Yeah, I can't see nothing there.
Yeah, and we did the crown portion as well. We did just 3,500. Now, if you get a good result with less number of grafts, another important thing which I would like to highlight here is, when we do FUE, see, we do cherry picking. We take out multi grafts.
Okay.
So, had we done entire thing FUE from this area, we would have extracted all the multi grafts which were present in this portion.
Okay.
That means all the multigrafts gone. That means more number of hair per graft. Okay.
Yeah.
So suppose if we were doing say 3,000 grafts, mostly multigraft with a multiplication factor of say around 2.5. So 3,000 into 2.5 means we 7,500 grafts. So, but if we are doing FUE, then we don't have leverage to choose multigrafts. So 3,000 of your grafts have come from FUT. That means multiplication of around 1.5, 1.6, maybe 1.7, not more than that.
Around
that-
5,000.
Maybe less,
Yeah,
maybe
maybe
45 to 5,000 there.
45 to 5,000.
So when you get a result without damaging your donor, using less number of follicles and less number of grafts and less number of follicles also, because we are doing,
Yeah.
we are taking out less multigrafts, and then we are not using finasteride. So even if you at that point you get results, now just compare this to the short-term goal clinic, where we are giving finasteride, we are doing all FUE, we are consuming the donor area completely and taking out grafts from the unsafe donor zone, and then that's the thing, you know. So while comparing results, one has to be very careful. Secondly, sometimes people just go mad for density. See, now if I could have placed more grafts. See, if I had done the entire thing FUE, I could have placed these grafts even closer. But they are close enough.
Yeah.
They are very good. They look nice, so nice. But I could have done it even more. But that means I would have consumed a big chunk of graft in a small area. And if the area behind it goes bald, there is high probability that it may, even after all the medications, even then it can. So in that situation, I am creating competition for myself because I have given a huge density, great density at the cost of donor, consumed the entire donor. Now no donor is left, and I have big areas to fill, and to fill to that extent that it does not look bald, and then obviously the density should match. But the density cannot match because I have very small donor left.
True.
So I'm creating competition for myself. So please, I'm telling this for those patients who are young, who have low grade of baldness, who think that, who are mad about density because the things are being shown to you in that way, where oh boy, oh brother, see this, look at the density, man, come on. So please don't go mad about all these things. Use your mind, use your brain. People who are, I mean, doing all this, probably they have half knowledge, incomplete knowledge, and probably they don't think about you that much. But you are the one who should think about yourself. You are the one who has responsibility towards yourself to take care of your donor and everything. Now the second part was pain. You are like apprehensive about pain also.
Yeah.
So anything you would like to tell us about that?
So yeah, before the day of the surgery, I was scared. I was scared like maybe I will get irritation or maybe I'll get a pain, lot of pain. I was alone. Like I came to Delhi, I was alone, so no one is there to help me if I get excess pain. So I was like, okay, so let's see. After the surgery is done, and next day I came to remove the bandage. Nothing. There is no pain, zero pain. On the next day, I myself fly to my home, so there is no pain, no irritation in these 15 days also. Like in the past 2 weeks, there is no pain, no irritation, nothing.
Okay.
It's like too good.
And the second issue which you had, I mean, which is actually blown out of proportion because of reasons, that is the scar of FUT. So now we can see, we hardly see the.
Yeah, it's like hair is very, 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 very short, but I can't even see the scar.
So,
and the stitches are removed just now.
Yeah. So people who are like scared of scar, keeping the hair short, and who think that FUE is a scarless surgery, they should probably rethink the strategy, because FUE also leads to scarring. You know, the density is reduced throughout the scalp from those areas. Sometimes you see small, tiny white dots in some patients where FUE is being done. So FUE is not a completely scarless surgery. FUT, now another thing is like utilization of donor. So if we see this, you have a good stitch line over here, and if I want to fill the middle portion of the scalp, suppose later on if I want to fill this portion over here, then I can take out grafts either by you doing another FUT, because the elasticity is still good. So I can include the scar of this surgery and I can take it out, or else I can take your beard. I did not touch the beard this time.
Yeah.
So people who are telling you that okay, you need beard and body hair, we haven't touched it. It is still there.
Still there, yeah.
So it is very important to keep your donor reserve, like for
the future. Yeah.
Exactly. So if okay, so in case we had done the entire thing by FUE from the scalp and maybe beard and maybe chest, we could have managed this number 3500 or maybe 4000. But what would have happened to the donor, scalp donor, in that situation? See, the demography of your donor would have been disturbed.
Is disturbed.
Because then you would have left with only single unit grafts because most of the multi units were gone. Now, later on, if you need more transplants, we have a good number of multigrafts still left in this area because FUT did not disturb the donor demography.
Yeah.
That is again very important.
Yeah.
So all these things are important when you opt for a transplant surgery. What I see, a lot of people get mesmerized by advertising, and some cricketer, some actor, some singer got a transplant done there, so I should go because. So I don't believe in these paid, what you call, promotions and endorsements. A lot of people pay money to celebrities to get their transplant done there and then shoot them a video.
Yeah. Yeah.
But this is not good. You should use your brain. Why does somebody need that? And how can your transplant be a good one just because some XYZ celebrity got a transplant done somewhere else? You know what? No.
No.
So, any message you want to give? I'm really happy for you.
No, just I want to tell to the guys who wants to do the surgery. I want to tell to the guys who want to do the surgery, like, so first you need to research completely on the methods which you want to do, FE or FUT. First you need to know the limitations, which methods gives what kind of the results. Then you have to be sure which doctor is operating you and what are his the past results. Then you can give a try. It's a very good process, like, but you have to select a good doctor to be done the surgery to do the surgery.
Yeah. If you see the hairline, it looks pretty dense from the front. Up till this portion, we have done transplantation, as you can see over here. And then I did a little work in this portion over here. Then this is the crown area over here, which we did. And we can already see the hair growing in length. Now, the most important part. See, if you take a look at the stitches which we have just now removed, hair are growing through the scar tissue. And it looks very, very beautiful. If you see this, it looks awesome. And if we take a look at the FUE donor, we can see now there are some gaps already because we have extracted these hair. Now people sometimes think that hair come back when they do FUE because the donor is being shown in that way, which is not the case. Hair don't come back. And just turn around a little from this side. Yeah, down. So if we see this also, the stitch line looks pretty good. This is MHT technique where we did FUT and FUE and this combination. So just imagine what would have happened to this portion over here if we were doing kind of the entire thing by FUE. Now this area we did not touch, which comes in, you can say, unsafe category. Anything above this is unsafe, but if we are doing only FUE, then obviously we have to go beyond the limits of safe donor zone. So even if you think that you know everything about transplant, I guess before watching my videos, you also thought that okay, FUE is the only thing, and and probably that's the latest and all that stuff. So we did your FUE. I did, in fact, my surgery was total FUE, not FUT. So it varies from person to person, and one has to select these based on the need of the patient rather than the fact that I do what I know. So if you choose an incomplete clinic which does not know FUT, which does only FUE, then you are in trouble. You cannot do justice to your donor in high grade of baldness or in progressive baldness, which can be progressive in so many of you. To make use of your full donor, FUT has to come into picture. Suppose if I had done only FUE in your case and would have met with the whatever requirement was, I must do another, like the second surgery in your case, then again would have been FUT, not FUE.
Yeah.
Because second FUE would completely demolish, destroy, damage the donor area, and with very high percentage of graft transaction, where grafts get damaged because the angles change. So all these things are important, and I hope you understand this well, and I hope this video helps. And thank you, Venkatesh,
Thank
for
you, doctor.
sharing your experience. And by the way, how does it look like?
It looks like when my mom sees also like the frontal part, it looks completely natural. Like no one can differentiate between. No one can tell that is transplanted hair. Like no one, literally no one.
So you are
can,
planning to keep your hair very short,
yeah,
this short, even if you keep it that.
yeah. No one can tell.
Okay.
No one can tell.
Amazing. Really happy. Thank you so much for watching the video. And if you have your questions, and if you really want a correct assessment of your donor, which is so important, please contact us, share your pictures, share your concerns. We will help you. And yes, choosing correct technique, choosing correct doctor, uh, correct method at right time, correct medication, correct post transplant planning beforehand. All these things are important. Please, thank you. Love yourself. Stay blessed. Thank you so much.
Thanks. So.